Okay, so this is my presentation on healthcare in America. This is about Obamacare. One of the reasons why it's pertinent, about 19 million young adults ages 18 to 34 lack health insurance, according to the Washington Post. Another thing, if every state expanded Medicaid, about 8 million people would qualify for Medicaid. Another 9 million would qualify for subsidies because they make less than 400% of the poverty level. 54% of Americans oppose Obamacare. So we're trying to figure out why that is. I think it's a good thing. We're just going to try to look at and see, research what we can do to find out why people oppose it. Maybe they're misinformed. Some of the research questions I have: what do people not like about Obamacare? Can people afford current health insurance? Are doctors willing to work with the government to inform patients about health insurance? And the problem: people are misinformed about health insurance. Some people do not want health insurance because they can't afford it. They don't think that they need it. They think maybe they're healthy or they're younger. They don't really think they need it. Or maybe they're older and they have a pre-existing condition and they don't think that they can afford it, because generally those people have to pay a higher premium. Also, they don't want the government involved in regulating things. I know a lot of people say that Obama is like a socialist because he's trying to regulate the health insurance more. Methodology, what we could use to find out why people don't like it, or if they do like it. We could use a social media campaign, a news campaign. It could be on the news more, try to get on the news more. We could use interviews, surveys, more information readily available at the doctor's office. So interviews you could do online or face-to-face. I know, like, I'll show you my Geisinger. You can log in, here it is, and you can talk to your doctors. It's more convenient connection to your doctor. You can send them emails or have questions about your prescriptions or anything like that. So that's an idea. Also, WebMD is a big thing. You can talk to doctors or, find out about pre-existing conditions and stuff like that. So that's an idea of what we could do for that. Social media, you could have it on Twitter or Facebook or something like that, but I don't know how many people would want to use social media with link that up with their My Geisinger or anything like that, because it's more private. You don't want to link up your healthcare stuff with your social media things where everyone can see what you're asking and stuff like that. The target population that we're targeting are patients and younger people without insurance. They were mostly the people of the 53% that I talked about that don't want to have the insurance. So they think they can't afford it. They don't want to. They think that it might replace their Medicaid, which it shouldn't. And young people without insurance who think that they don't need it because they don't have pre-existing conditions, or they just think it's better to just pay out the money if something does happen instead of paying a premium all the time. Some of the research that I did to find out more about this. Obamacare does not replace private insurance, Medicare or Medicaid. You guys can kind of read that. I'll leave that up for a little bit. Won't read it to you, but it gives more preventative health insurance, more preventative health care. Like you could get a colonoscopy or a breast exam, stuff like that. And also it makes it so that women cannot be charged different rates than men. Seniors have access to cheaper drugs, free preventative care, reform, Medicare Advantage. It closes a lot of the loopholes up. And it says here that according to ObamacareFacts.com, 1 in 2 Americans have a pre-existing condition that they could be denied health insurance for. So that wants to close that up little by little over the years. That way that people don't have that anymore, so that everyone can have it by 2017. 54 million Americans with private health insurance now have access to preventative services with no cost sharing due to the new minimum standards. I know that birth control is a lot more readily available now. A lot of people get that cheaper or even free now. The current $2.8 trillion U.S. healthcare system costs about $9,000 a year for every man, woman, and child. So for every person, that's about $9,000. A couple things what we could use for how this is relevant to our communications class: the health belief model, the degree to which individuals anticipate the negative effects of a practice or habit determines the possibility of persuading individuals to quit undesirable practices, habits, and behaviors. So if I'm practicing not having health insurance, if I think that maybe that will have a negative effect on me, I'm more likely to try to get health insurance, even though I'm young and don't have like a condition that would make me unhealthy. I could still get that because this is talking about your health, and this will if you, people tend to try to do things that want to make them more healthy. So that's one thing. Social support, which is associated with how networking helps people cope with stressful events. The theory also helps probe the value of one's loved ones, friends, support, and a person around a person who is sick. So if I'm sick, then my family should probably try to, it like directly affects them, so they will probably want to help me and they'll want to get health insurance also. Theory of planned behavior and reasoned actions. A person's behavior is determined by his or her intention to perform the behavior. That intention is in turn a function of his or her attitude toward the behavior and his or her subjective norm. The best predictor of behavior is intention. So if my intention is to not have health insurance and then that's like not a norm anymore, then more people have health insurance, then I'm more likely to turn around. That will change my attitude. I'll change my attitude towards what is the more of the norm of what's going on with everyone else. So that will change my intention, which will in turn change my behavior. Um, right now, it's about half and half people who think it's a good idea and people who don't. So we're trying to find out what we can do to change that. The agenda setting theory, as far as our campaign goes, I would try to use the social media, the surveys, the interviews to inform other people and find out what they don't like about it, and then we could in turn use priming to give the audience the question of if they were sick or needed medication for a chronic condition, what they would do. That would give them a little bit of, they might not have a plan really, so then that could give us a setup to tell them that we have a plan for them with the Obamacare. Lessen the knowledge gap. Use social media to inform the patients when they take the survey. If they don't really seem like they know a lot about it, we could try to lessen the knowledge gap a little bit. I know that a lot of people are not really informed about the issue, and that is because of the gap in education between the higher and lower class. So a lot of people that are richer, they don't really care about having the more poor people be having a health insurance. They just think it is a I don't know, something that is just for them because they don't really care if other people have it or not. It's just whoever it's available to. They don't want to wait in line or anything like that. So we could use the social media to inform more people and try to get them more informed to try to lessen the knowledge gap so everyone on the lower end of the spectrum knows more and more about it. And then just use sense making to allow the public to make their own decision. So they can shop around for insurance in a more efficient way to purchase their own health insurance. And the outcome, hopefully, less people will want Obamacare repealed. More people will have health insurance they can afford. More preventative procedures will be done, and overall, we'll have a healthier country. This is my works cited. Some things from MSNBC. Klein, Ezra, will young adults want Obamacare? That's from the Washington Post, and then the Obamacare facts. If you have any questions, you guys have my email. Just let me know. I think a couple of you have my cell phone number if you want to shoot me a text or anything like that. That's it. Thanks.